This webcast and any accompanying materials are copyrighted by the American Association for Respiratory Care. Any public display, sale, copy, or distribution of the video or materials may only be undertaken with the prior written consent of the AARC. Copyright 2015, all rights reserved. My name is Shauna Strickland. I am a respiratory therapist, certified asthma educator, and Associate Executive Director of Education at the AARC. I welcome you to today's presentation, Managing Asthma on the College Campus, Findings of a Texas Pilot Study. Upon completion of this AARC webcast, participants will be able to identify the research question of the study, identify the study design, discuss the main results of the study, and discuss the implication of the study on patient care. I am pleased to welcome Dr. Dave Burnett. Dr. Burnett is a registered respiratory therapist and certified asthma educator. He is the chair and assistant professor at the University of Kansas Department of Respiratory Care Education in Kansas City, Kansas. Dr. Burnett is also the co-director and founder of the KU Asthma Center, and his current research focus is exercise-induced bronchoconstriction and community-based asthma self-management. I disclose that I am an employee of the American Association for Respiratory Care. Dr. Burnett has no relationships to disclose. Brand names of products may be mentioned only as examples of technology. Dr. Burnett, welcome to the program.
Well, thank you very much, Shauna, and I'm very pleased to be here discussing this topic with all the listeners out there, and primarily because I really like the format that's been created for us to discuss topics that we're all interested in, because to me this is kind of like basically a journal club on steroids, so to speak, to where we can take a look at articles and, without getting too caught up in the details, talk about the kind of the science behind the articles. So with that said, we'll go ahead and take a look at what we'll be discussing today, and of course that is the article about managing asthma on college campuses. And the first thing you really want to do before you take a look at an article is want to make sure that your source is pretty credible. And what the authors did right up front, is what should always be done, is to identify that there's really no conflicts of interest here from a financial or personal gain, and therefore you can pretty much assure that any of the data being reported and collected, of course, is pretty valid and trustworthy. Okay, so that's the first thing. Next, we're going to look at a research question. So when any article is presented, it's always based on some form of work, and that work started simply with a research question. But it's not so simple, because it's very difficult at times to kind of come up with a research question. I noticed that through the chat room there were a lot of kind of creativity and humor that was occurring because of the sunny weather or not so sunny weather. I wish I had a window to look out of. So that creativity is a good thing to have, because you really need to be a little bit creative when you kind of form that research question. So the authors here in this particular article were able to identify two main questions that they wanted to try to answer. And as you see those on the slides, they wanted to determine how the student health centers in Texas are actually managing asthma for their college students on their campuses. And more than that, they wanted to dig a little bit deeper. They wanted to look at what the perceptions and the attitudes of that impact of asthma might have had on that student population that they were studying. Okay, so now they have the research questions, two of them in this particular case. So we want to make sure that those questions are really relevant. You know, do they have some type of an importance? And of course, we all could probably agree that the problem here with asthma is pretty relevant. It is a significant health issue and also a financial burden. We know that it impacts a large population of people, and here in this particular case, in this article, the authors were looking at college students on campus, of course, in the state of Texas. And they also want to make sure that it fills some gap in the knowledge. So is there really much work being done here? And if not, then let's kind of explore and learn a little bit more about this particular area and therefore they were looking at what they felt was a good area to try to fill a gap, and that was specifically at those student health centers on the college campuses. And also we want to make sure that it has some type of relevance or importance to clinical practice. And again, I think we can all agree that studying asthma and specifically the area of chronic disease management to try to control the burden of asthma has some pretty good relevance. So I'd like to kind of take a pause here for just a little bit and poll the audience. And as you practice beforehand, you can, I believe, click the little green arrow if you want to answer yes, and then otherwise hit, I believe it's the red if you want to answer no. But for those of you out there, a simple yes/no question. Let's poll the audience. How many of you are working with some form of asthma education within your current job? Okay, so we have about 298 in the main room. Some of you are kind of holding on. Let's see some more answers. We're looking at about 53 or so of you actually are using some form of asthma management in your current job. It's split about half and half. Well, very good. So we have some of you that are working within the area of asthma education. Some of you, of course, are wanting to learn a little bit more about it. Perhaps you will take from this some ideas that you'll use in the future. It's excellent. So now let's move on. We have a research question. We've kind of determined that it's really kind of relevant to what we want to learn about. And usually then you kind of set that research question up into a hypothesis that you want to disapprove that particular theory that you have to, of course, take an investigation kind of aspect of the study itself. This study, we won't really dig too much into that area because it's a descriptive study. And that's not a bad thing. It's actually a really good thing because we're learning a lot from this study that we can take from the naturally occurring environment and describe what is occurring, learn from that, and then be able to take what we learn and move on to potentially even a larger study and then develop some hypotheses from that. Okay, so we're looking at mostly a descriptive study in nature, which we'll really dissect in just a little bit. Okay, move on to the next one. So before we start, like most papers should pretty much be included with all papers, is kind of a literature review or background. So now the authors have determined a research question. They've identified what they want to go out and explore and describe to us. Now they're going to go out and do a little bit of literature or background work on what's really occurring in this area right now. Well, we all know that asthma is one of the leading causes of chronic respiratory diseases. Has about $56 billion of medical expenditures are spent on asthma annually. Almost 26 million Americans are diagnosed with asthma. The incidence of asthma is growing. The proportion of the population staying relatively stable, but obviously the population is going up, so the incidence therefore is increasing as well, which is an important issue, of course, because of the economic burden that we've been talking about. So let's look at this population specifically, meaning why are we studying this population? Is there really a need to? And when you look at the CDC numbers on asthma across kind of different subsets of the population, and then you compare the college campuses to those populations, you can actually see that the college campuses' prevalence of asthma is pretty much up there kind of on the higher end of these different subsets in the general population. So obviously there's a need there to take a look at, and the authors did a good job of pointing that out. So some other important issues that the authors were very diligent in letting the readers understand, and that is specifically when you look at the quality of life that's related to asthma symptoms, and then that association to that quality of life or that diminished quality of life that can be related to the symptoms affecting the self-esteem and academic performance, which is very relevant within this population of asthma patients. Also, it's been shown that valued life activities, such as recreational and sporting activities, can be negatively impacted by asthma, which then can have an association with decreased quality of life. So now you have college-age students who probably for many of them, their stress relief could be getting out and exercising. That exercise could become difficult for them because they're not controlling their symptoms very well. And then, of course, that decreases their activity, decreases the quality of life, potentially then has an effect on self-esteem and academic performance. So it's all kind of a vicious circle there. So we've identified a kind of a relevant research question or two in this particular case. Now let's look at some of the barriers to what we've identified from those questions being problems. Two areas we want to focus on for the barriers to help with asthma management in the college students: misperceptions and poor self-management. So let's take another really quick poll, make sure everyone stays awake here. And I want everyone to answer yes if you have high school or college age children or child. We're staying awake. Good job, everybody. That's it. Keep them coming. Okay, 28. We have a few out there. I'm assuming there's probably more that's being polled. So we do have some folks with college age and high school age children. Well, I happen to have a young man that's 15. Well, young man. He thinks he is, but he's 15-year-old adolescent that's in high school, and not a whole lot different probably than your 18, 19-year-olds when it comes to misperceptions about themselves. And that's, of course, the population that we're talking about. We're talking about that 18, 19-year-old that's entering college, and they're not too accurate in assessing the severity of self, especially when it comes to their health concerns for the most part. And that's, of course, generally speaking. A lot of times they don't seek medical attention, even when they have severe symptoms. And they may even believe that asthma just to be an episodic disease. We see that in the general population a lot, that many people do not really identify as a chronic disease, but rather it's just a kind of episodic type of disease pattern. When you start to feel better, go off the meds, those types of things. So, of course, due to that, a lot of the students that are on these campuses are not complying with their meds very well. So let's take a look at the self-management aspect. No parents around anymore. Guess what? Mom's not there to put the inhaler in the backpack or to make sure that student takes that inhaler before they jet off to school or when they come back home. So those students are likely not adhering to their pharmacological treatment near as well as what they did when they were back home in their underneath the roof of their parents' home. And then you have that vanity factor, of course, just like we do with a lot of our adolescents and kids. Is even extends to the college-age population. So you put these misperceptions together, the poor self-management in this population, and you have as a kind of a perfect storm of sorts. If I may take a little term from the editorial on this particular topic today, that you all should read in the Respiratory Care Journal that just came out in August. A little kind of plug for that anyway. But you have this combination that equals an increased risk for hospitalizations and, of course, potentially increased morbidity of the disease. Okay. So now that we have a problem, we've kind of identified that based on the research questions. And now what do we do about that? So the authors here have done a good job of framing in the potential for the student health centers to have an impact on this particular area. And that's exactly why they did all this work in order to, and then of course publish this article. So without stealing too much of the thunder and explaining what that is from the authors, we'll explain that as we go through, but we have multiple healthcare resources for this particular age group and these students around college campuses, but they're really focusing on that student health center aspect. So let's look at the purpose of the study then, because that's always a very important part. In order to get this into publication, the authors really should do a good job of identifying, okay, what is the purpose here? And to kind of wrap that up into a nice, concise story. But it really needs to attempt and be successful at identifying what the problem is, which we've talked about, that there's a gap there, and their literature review, of course, showed that there's very few studies on how to help manage college students, especially within the student health centers. So that will help improve our knowledge. So now we're filling that knowledge gap by reading this particular article. And then, of course, that research question. They're going to develop that research question to really get at the meat of how to fix that problem and fill the gap. So we're going to review those questions one more time as we go on. This is a very important part of the whole project. So before we actually get to the nuts and bolts and start to look at the methodology, we want to really remember what we're studying here. Number one, looking at what's going on with the student health centers in Texas. How are they managing asthma for their students? And deeper than that, we're going to look at the perceptions. So the beliefs and attitudes of the student health centers directors. Those beliefs and attitudes on how asthma is affecting their student population. Okay, so let's get down to the nuts and bolts. First and foremost, we're looking at a descriptive study. It's a cross-sectional pilot study as well. So let's kind of break that down a little bit. Descriptive, as we mentioned earlier, is a non-experimental study. And specifically, we're looking at both quantitative and qualitative data. Quantitative, we're basically looking at numbers and percentages and describing the population and the study participants that the authors went out and, of course, did the work with. From the qualitative standpoint, which is where I really applaud the authors because of their ability and hard work and effort, because this is a really difficult thing to do, is to conduct interviews, gather that information, and put all that information together to come out with some form of a trend to be able to tell the story. And that's exactly what these authors did. It's cross-sectional study, which means basically the data is collected at one point in time, rather than, say, do a repeated measure where you maybe do an FEV1 and then provide a bronchodilator, do an FEV1 again, therefore you have repeated measures. This study was collecting data at just one point in time, therefore a cross-sectional study. The study is also a pilot study, which are very important studies, especially to identify strengths and weaknesses in order to go ahead and move towards kind of a larger, say, randomized controlled trial. From that pilot study, you can gain a lot of information that will help you develop a larger study in the future. And a lot of times, pilot studies are done to assess what's called an effect size. So if you want to use the smallest number of participants to get a significant effect on an outcome, then you have a more powerful study if you use fewer participants to get that effect that you're looking for. In this particular study, they didn't really use a power analysis per se, because again, it's kind of a descriptive study, so they're just kind of gathering information to describe to us what they found out in the natural environment. Okay, so ethical considerations, always very important. And primarily for this study is they use their own state's kind of institutional review board, and what that does for them is provide oversight to focus really on number one thing, and that is the safety of all the participants. The safety meaning just basically protecting their data, protecting their privacy, or it could be safety to make sure that whatever you're doing on your participants is not too dangerous, and you basically get more benefit from the study than you do a risk of having harm to the participants. They also, of course, identify that they obtain consents, and consents were obtained from each participant before completing any of the survey data whatsoever. So when we look at the methods, once again, so we're still in the methods, and then we'll move on to the statistical analysis. You look first and foremost at the inclusion and exclusion criteria. And here, they're looking at 4-year accredited universities in Texas. Okay, they wanted at least 1,000 undergrad students enrolled in these institutions. And the basic and main exclusion criteria was that they did not want to use online colleges. I think everyone can understand for the obvious reason. They were basically looking at students that were on campus and walking around and able to go into the student health centers. So let's kind of get a picture of what we're doing with this study, kind of the recipe of what's occurring. So we look at a study schema. So they basically were looking at the 4-year accredited colleges, and they identified there were 70 colleges with over 1,000 undergraduate students. They then randomized 20 different institutions from those 70 colleges. And from those 20 institutions, they were able to get 17. And we'll talk a little bit more about that proportion of 17 from 20. But they were able to get 17 institutions that would participate. And then they stratified that. They kind of divided them up in subsets just for analysis purposes, because they wanted to look at the different, compare the different size of institutions and affiliation of the institutions, that being public and private, and also the location, that being urban and non-urban. Okay. So let's look at the power analysis, because that's one thing we want to kind of assess when we do any type of kind of analysis of an article. And again, as mentioned earlier, this is a non-experimental study, so we're not really measuring effect size or performing a power analysis here. But I just wanted to bring this slide into the mix so you kind of understand when you see a power analysis done that that's what they're looking for in pilot studies, is to be able to identify the effect of the intervention they're doing. So they're trying to determine then for a larger study, how many subjects will I need, the minimum number of subjects that I will need in order to get the effect that I anticipate. Okay. So now for any analysis that you do, you have to have the tools to gather that, whether you're doing a puncture or whether you're doing a vent check or whether you're doing a bronchoscopy, or here, whether you're collecting information from, say, a survey with student health center directors. So their tool was just that. It was a survey that was used previously in the state of New York on a study that was done there, which we'll talk about in more detail later on. The survey had built into it some descriptive statistics, which were there were 4 domains that gathered quantitative measures, which we'll move on here in just a second and talk about. And then the last domain was actually gathering qualitative data, which is explained earlier. They're basically getting commentaries from the student health center directors in order to identify some common themes and clinical characteristics that are occurring. Okay. So let's begin by looking at the data. And this is really where you start to kind of get at what the true message is here. And the statistics are able to tell that story. So the statistics are actually a very important process, and it's also one of the very significant parts of the article, because obviously the statistics can be used to really have a true impact on the story itself. So again, this is a descriptive study, so we're going to describe what took place in these student health centers, and first and foremost, we go back to that response rate. So before you embark on a large study and say, I'm going to go out and look at 5 different states and we're going to study 200 different student health centers. Before you do that, it'd be good to do a smaller study to identify, well, how successful are we able to be just to recruit these student health centers. In this small pilot, they were able to get, as mentioned, 17 out of 20, 85% success rate, so that's pretty important. We identified the mean size of almost about 15,000 students, and as you see the breakdown there, with that size of a mean, it's pretty evident that they had mostly larger institutions when they broke them down by size. Affiliation, they were mostly public, and their location, they were mostly urban college campuses. So when we kind of describe what the population is that are actually working within these student health centers, both from a directorship and also staffing, as you can see, the directors were kind of split between the MDs and RNs. We had 3 nurse practitioners and 2 PhDs that were directing these student health centers. The staffing trends, you see about 90% were female. 9 out of 17 of the had MDs at their student health centers. You had one student health center actually had both an MD and a DO. And then you had 6 of them with part-time MDs. And 2 of these student health centers did not have an MD at all. And a trend was that for the more larger institutions, they were more likely than the smaller ones to have the MDs as a staff member of their student health center. Okay, so important thing, tracking those visits. So we all know it's very important to be able to identify the number of patients that are coming in and out of the hospitals, or in this particular case, the number of students that were going in and out of that student health center. There are only 5 of 17 student health centers who are actually tracking that data. As you see, there's a large range there from the number of visits annually. The majority of these student health centers did have the ability to treat allergies and provide allergy shots. So as you're listening, and hopefully still keeping your head up above your desk and paying attention to the talk right now, we are starting to tell a story a little bit about what's occurring here and kind of describing the setting of sorts of what the authors were doing when they went out and studied this particular area. The participants of the study, of course, being the student health center directors, and then the need looking at the students on the campuses. So I wanted to kind of set that up because I wanted to hopefully bring you back into the talk here if you're kind of zoning out and looking out at the nice sunny weather through the windows that you do have there. This is really going to start to tell the story now, and the authors did a fine job of doing this. Asthma action plans on these campuses, what is really being done with them. And I think we all can agree, hopefully, that asthma action plans are one of the best tools to help with asthma self-management. Well, this particular study here of these 17 health centers, there were only 4 that adopted the use of asthma action plans. About a third of the student health centers had an emergency plan in place for an asthma exacerbation. And as you see, less than half, about 41%, had any protocol for handling on-campus asthma attacks. Okay. So, educational information. A pretty diverse group of educational information that was provided. One of them we probably don't like to see is when asked what type of information that was provided to their students on campus, they did not know what type of educational information they did provide. So let's stop and take a break for just a little bit. Now I want to ask a yes/no question once again. So, and this is more of an opinion than it is anything from asking you what you do or don't do. But I want you to click yes if you feel that the best use or best vehicle for delivering, say, educational information is by paper-based pamphlet kind of handouts, or click no if you think it's best to deliver that through some type of a technological vehicle or medium, such as through an email or through a website to this population that we're talking about, and that's college students. So yes for paper-based and no for any other vehicle such as technology-driven. Okay, it looks like we have about 76 for technology, 77 against 20 for paper-based. Very good. This is an important question. I'm not saying that one's either right or wrong right now. There's studies that are still showing that when you look at preferences of the type of material that patients would like to see, both in younger and adult populations, they're starting to trend more towards kind of technology-driven. but there's still some conflicting reports on that, so I can't really say that we're going to agree or disagree, and also trying to be politically correct as well. Okay, so let's move on to the next slide now. So we're going to start to talk about the qualitative data, and this is really, again, where I applaud the authors for a great job of and a very hard process of gathering this type of data and putting it together to tell a meaningful story. And I think they did a really good job of doing this. So the first question, they ask 4 questions basically to get some narratives on the perceptions and attitudes and beliefs of the Student Health Center directors. The first question was, how satisfied are you with the services provided by their Student Health Center? And 70% of them said they were satisfied with their services. About 3 of 17 had mixed feelings, and mostly those mixed feelings were due to the fact they were just trying to adhere to the EPR3 guidelines, but they were just, for whatever reason, were having difficulty being able to do so. And then a couple of the Student Health Centers did not even answer that question. Okay, the second question that was asked to the Student Health Center directors was, what do you feel is the impact of asthma among students on campus? There was a trend for the large universities telling this story that, hey, we have a major problem here. And that problem is it's undiagnosed and undertreated. And I should back up a little bit in what I'm trying to say and trying to actually see through my dirty glasses here is that it's underdiagnosed and undertreated. Okay, so we probably have, since it's underdiagnosed, there probably is some undiagnosed asthma out there as well. But it's not a whole lot different than the general population, quite frankly. We have what we see with the same on the college campuses as well. Some of the directors reported that they felt there was an impact of exercise-induced asthma on their campuses, and almost half of them perceived the impact of asthma to be seasonal, and mostly climate as a factor due to the humid, moist, and desert-like climates that they see within the area that they were polling or surveying from the 17 health centers. Okay, the third question, asking those Student Health Center directors, what do you feel the barriers for these college students to actually seek treatment there at their Student Health Centers? And what I did basically is just copied and pasted the table 2 of this article, and wanted to throw it up here, and just for brevity's sake, list some of those particular ones verbally, and that is accessibility. Also, they feel that the money could be an issue, so that's a barrier as well for students coming in to see them at the Student Health Center. The students' lack of understanding that this is a chronic disease, so we go back again to that kind of episodic disease kind of misperception. And then also lack of awareness that the Student Health Center even exists there, and this is coming from the Student Health Center directors, that they felt that there's a lack of confidence from the students regarding the Student Health Center. Now, let's look at the 4th one here. The suggestions that the Student Health Center directors have for influencing students to visit their Student Health Center. All reported that education about the health services is key. So they need to get information out there and educate the population about asthma, and specifically the aspect of chronic disease management with asthma. And as a result, need more face-to-face education with the students and even the parents. They felt that the influence of students to visit the health center, the students needed better health insurance coverage, and they needed to be more visible. And what was some of the information that came out within that statement was perhaps they could use social media to help improve awareness that they do exist and they're there to help, and that students can increase their awareness about asthma, and not only asthma, but hey, we're here to help you manage that disease. So the article will move on to the discussion now, and I will explain the discussion mainly in the context that the authors will usually use in a format that will be used in an article to explain specifically what the impact of this article is telling, the story that it's telling, and also to kind of put into comparison and contrast to other work that's being done within this same area. So the authors then, from this particular study and taking all this information together and describing it now, are suggesting that improvements are needed in more face-to-face education for asthma chronic disease management. So they felt by going out and exploring the student health centers that come back from that this is something that's really would have an impact on helping the students on campuses. They felt that there needs to be more promotion of the student health center asthma services across the campus. They need to use individualized asthma action plans and emergency plans. And we need to have better record keeping on the student health center campuses or at the student health centers so we can track the visits that are going in and out of their doors. Okay. Now let's compare the study here to another study that was done, and that's just it. That the authors described their work in having in comparison to other work, which is basically pulling a study that was done in the state of New York. And in contrast to that study is the Texas study actually was more likely to have larger schools and a facilitator to coordinate the student health center program. Okay. Both studies actually, though, were found to have larger schools to have a physician on staff. And a majority of the student health centers in both studies provided educational material. Okay. More face-to-face asthma education with the students and parents were actually discovered to be needed in both studies. And they also identified that there's a lack of awareness across all the student health centers in the state of New York and Texas study. So both sites also did not really keep thorough records or track the visits of asthma-specific visits in the student health center. And the authors did a nice job of pointing out that's pretty consistent with a large survey that was done that looked at asthma students arriving on campus. So that transitional state from hometown to the actual campus. And the study showed that there really was no system in place for the transitional care. So here's a slide right here that kind of I think tells about as much of the story of anything within this discussion, and that is that less than a quarter of the student health centers in both of these studies used asthma action plans, and about a third reported emergency action plans. However, the majority of the respondents in both of these studies reported to be satisfied with the services they offered. So you can kind of use your own kind of theory there, but it seems to be a little disconnect that a quarter of these student health centers are actually using one of the best ways to help students understand and control their asthma, but yet the majority of the respondents, the directors, are reporting to be satisfied with the services they offer. So let's look at the limitations before we go on to the conclusions. Limitations is not a bad thing at all. Matter of fact, every study is going to have limitations. It's just the nature of the study. It's a good thing that the authors bring this to the surface and explain that, and then explain, of course, how they may have limited those limitations as good as possible. So first and foremost, there's really no cause and effect that we can gather from this particular study. We're simply looking at associations only. This is a small sample size, so we're talking about 17 colleges. However, it was a good amount of information that was gathered in order to tell a story and determine that there is a need to explore this within larger studies in the future. We can talk a lot on internal and external validity, but basically what we're meaning here is are the actual testers or the researchers, the study team, are they actually getting the outcomes from the test that they actually mean to study in the first place? So are they actually gathering and getting the outcomes that they really are seeking from initially? And there could be a little bit of difficulty with doing that in almost every study, such as for this particular example, when you look at multiple examiners, it's very difficult for one person to go out and survey all of these individuals or all of these different student health center directors. So you have multiple examiners to do that at times, and that enables you to get more data in rather than just having one person do it. That could mean that you have some kind of bias amongst those researchers that ask the questions, and meaning how they may ask them may be a little bit different amongst the 3 different examiners in this study. Also, reactive effects from an external validity standpoint. So for example, if we go and speak to the student health center directors and we ask them, how do you think you provide asthma services to your population? They may overreach a little bit because they're being asked directly, and they may kind of put themselves up on the 1 to 10 scale a little bit higher. So does that mean that that has something to do with the fact that they report being satisfied with their services, but yet when you ask them about their asthma action plans, that they rarely use those, or a quarter of them actually use them? So there may be a little conflict there as well. And then the data is collected differently, but again, I go back to with these particular authors, they bring that point up, but I say that from them going out and getting more data by being able to use both email and phone, that's a good thing than only relying on one source and getting less data. And then of course they point that out in their limitations, which is a very good thing. So conclusions, what do we have here? 9% of the college students with asthma. This small pilot study does support the need to determine the effectiveness of the student health center's asthma programs in Texas and other states. So now we have a pilot study that actually has told a good story, showed that there's a need, and has a good impact on this population of asthma patients, and that we could go ahead and potentially do more work in the future. And they've also identified that we really need to promote asthma services on these student health centers and throughout the campus. So future directions, where do we go from here? So now we take what we've learned and we kind of identify, okay, what's the path that we want to blaze from this point? So I kind of separated this into 2 areas. Research, number 1, there's several different things, but just again for brevity's sake, I wanted to put in one particular area, and that is, how about just like the EPR3 guidelines state, what are the 3 key areas that we really need to focus on? You look at severity, so you need to do spirometry to do that. You need maintenance, so you need inhaled corticosteroids for maintenance management, and you need to have that patient leave with an asthma action plan. So those are 3 key components that can have the biggest impact on the asthma management for patients. So perhaps we can determine what it is with this college age population on college campuses that could have the biggest impact, and therefore focus our attention on those areas. And then I'll go back to the editorial that was just released within the August issue of Respiratory Care Journal, of which in that editorial they pointed out some quality improvement issues, specifically within the area of transitional asthma care. So again, what are we doing to capture these individuals as they come into the campus? A good idea, as the editorial pointed out, is there could be a registry that could actually capture all these college students coming into the campus and identify who they are that have had a past history of asthma, and they can be, of course, included in that registry, and you could reach out to them to obviously offer your assistance at the Student Health Center. Technology to help drive the protocols for asthma action plans, as we kind of touched on a little bit earlier, can also be a way to help with this transitional care. So what's our take-home message? Should be our final slide here. What's the relevance to us as RTs with this particular study? So how does our role fit into this study? So we are the experts in asthma management. And if you don't think you are, then study a little bit more and become the expert, because as RTs, we should be stepping up to the plate and fulfilling that role. We have many academic institutions that have RT programs. So why not those programs, those faculty members work with the students to help collaborate with the student health centers to provide some type of support to the students on campus. Also, we can spread awareness of the tools that the ARC provides, that other fine entities provide to enable the student health centers to have a rich library of information they can tap into. And even for those centers, those student health centers on campuses that may not have a community hospital close by, which most likely do, you can always connect with academic centers, colleges that can provide assistance, and that can be done through a vehicle of, say, even simply telehealth. So you can have an educational institution work with the health center on helping them with management of this disease and provide some of that expertise in the process. So I would like to close out then, and would offer up any questions at all, and hopefully we can answer them for you. And again, thank you very much for having me today.
Thank you, Dave. That was fantastic. One of the things that I was thinking of as you were closing your session was that, as you mentioned, most colleges have a community college. We have a lot of academic centers that are attached to universities and college. If I'm a respiratory therapist at a facility nearby a college, what kind of impact can I have with that student health center?
Sure. So if I can make sure you're stating it right. So let's say you're a therapist working at a hospital location and you're close to one of the fine community colleges or academic centers that are in the area. How can you kind of help with the academic center to provide services to the student health center? Is that correct?
Yeah, how can I help the Student Health Center beef up their offerings? As you mentioned, the colleges within the study seemed to be already providing the Asthma Action Plan, which we know is an issue, and not all of our asthmatics have an Asthma Action Plan. How can I reach out to the Student Health Center and provide expertise to help them offer better services to their students?
Oh, sure. Well, I think it begins almost like any collaboration. Just reach out, you know, have and be genuine about doing so, and let them know that that you're there, that your resources are available, and that you would be more than happy to help in any way, and find that connection. As your collaborations begins, of course, it's all about the connection and try to find that door that you can reach that can open you up to speak to the Student Health Center and see what there is that you can do to help them in order to kind of build that collaboration.
I recall being, and I'm sure that you have this experience as well, being on the University of Kansas campus, but I recall being on college campuses as an employee and having a lot of students come in and out with questions about their asthma, or God forbid they whip out their asthma inhaler in the middle of class and they don't use a spacer and they don't use good technique, and you want to cringe as they're attempting to give themselves the medication. So there's so many issues with kids, and I use the term loosely, transitioning from home life to college life and assuming responsibility and having to take over their own asthma care. And in addition to all that is the financial issue. Is there some sort of resource that we can recommend to our college-age asthmatics that could help them overcome that financial burden?
That's a good question, and of course, most people probably start that answer. That's a good question with, I have to find the expert in that financial area. But what I can suggest given my past experience, is connect with your local agencies. Your local agencies that can provide some assistance. Maybe it's a safety net clinic. Connect with your practices that you may know from a standpoint of your family practice that's a front line for this care a lot of times. Your allergy and immunologist, your pulmonary docs, that what resources they may turn to within that particular area that they've had the best success with getting financial help. Also, if you're on that campus, connect with your financial aid office. What I have found on our particular campus, and the questions go far beyond just how do I pay for my classes, but the financial aid officers and counselors have a rich amount of information and resources about what students can do. For example, in the area you're talking about, in the area of need for health care, of where they may go and contact to get financial help for that particular issue.
Perfect. A couple of questions out there about the relationship between respiratory therapy programs, academic programs in the Student Health Center, and I don't know if your experience is any different, but I think that the answer to whether or not there's a relationship from the program and the Student Health Center is it depends on the individual program and Student Health Center. So I would recommend, if there are any academics on the call today, that they seriously consider maybe getting their students involved in some sort of a service project with the Student Health Center to improve those services.
Yes, I think that's a great idea, and I'd love to take the praise for it, but I certainly can't, because we've had faculty members here that have done a tremendous job of building a very nice student organization that connects to the community. We connect with our other colleges around the metropolitan area as well to try to, of course, provide power in numbers by working with other respiratory care education programs, their student organization as well, get those organizations together, and then you can reach out to these student health centers potentially and let them know that we're here to help, whether that's just a health fair on how to use inhalers correctly, or so you can keep it specific, or just to provide information, and also, of course, how to use or monitor, such as right peak flows and use inhalers, etc. But yeah, you can do a lot, I think, through the student organization. You're correct.
Well, Dave, thank you again for joining us today. This has been a really good hour.
Oh, no problem. I appreciate it very much for having me.
For those of you watching, this is a live presentation. Please stay with us during the next brief pause for instructions on how to obtain your CRCE contact hour. If you're watching this program as an archive, this concludes our presentation.